Today we're going to talk about how to keep yourself safe, today's COVID risk for older adults. We have excellent speakers today. First, I'd like to welcome Mayor Marty Walsh. We are honored to have him join us today. We also welcome Margaret Reed, the Acting Chief of Staff for the Boston Public Health Commission, and Commissioner Emily Shea, who has been leading the city's Age Strong Commission for the last 9 years. Age Strong's mission is to enhance the lives of Boston's older adults with meaningful programs, resources, and connections so we can live and age strong in Boston together. I would encourage people to put your comments or questions for the mayor in the chat bar, as his Q&A is going to follow right after he speaks. And Susan Edgman Levitan will be the moderator today. I'm going to introduce the other speakers in the order we will hear from them. Meg Hogan is the CEO of Boston Senior Home Care, which is a not-for-profit serving over 8,000 older adults and adults with disabilities in the city of Boston. Their work provides resources and services for individuals to be able to remain in their homes with dignity and independence. And then my colleague, Dr. Juan Carlos Nunez Medina, who is a physician at the MGH Senior Health Primary Care Practice and also works on the Geriatric Inpatient Fracture Trauma Service, otherwise known as GIFTS, where patients who fall and have orthopedic trauma and get surgery are co-managed with a geriatrician to address their problems around function and things that happen when you're older and have surgery. And now I'm delighted to welcome and pass the baton to MGH President Dr. Peter Slavin.
Thank you very much, Sharon, and welcome everyone. I want to thank you and for our geriatric program for sponsoring this senior health town hall. It's important for everyone, including seniors, to take good care of themselves, and that's no more true than during this pandemic that we're all living through. So I hope you've all been well, and hope that this town hall gives you some pointers, some useful information that can keep you well also. Now, is Mayor Walsh on?
I'm here, Doc.
Okay, all right, great, terrific. Then I will go ahead and have the honor of introducing you. So we are delighted that Mayor Walsh has joined us for this town hall. As many of you know, he is the 54th mayor of the city of Boston, having been elected and inaugurated in 2014. I first got to know Mayor Walsh when he called me shortly after he was inaugurated and asked if he could meet with a group of MGH clinicians who had been directly involved in the care of marathon bombing victims. He made it very clear that he wanted to do this in a very private way, didn't want any press. And within a few days, he was at the hospital and met with some of our doctors, nurses, and other staff who did God's work in caring for some of the victims of that horrible bombing. I was just so impressed that so early in his term that he would take the time to do that. He didn't want to draw any attention to himself. He just wanted to thank, on behalf of people of the city of Boston, some of our caregivers, for a job very well done. And I know that that made a lasting impression on them. It also made quite an impression on me for the genuine, caring person that he is, and somebody who clearly has his heart in the right place. I've had the privilege since then of working closely with him on a number of public health issues, and his commitment to the health of the people of the city of Boston is truly impressive. His work on disparities, substance use disorders, and also the health of seniors in the city is quite impressive, and his track record is quite long. But I've probably gotten to know him best really within just the last few months as we've worked together to try to stem the impact of COVID-19 as it ravages so much of this country and the world. And he and I have been on almost daily phone calls with the governor and other healthcare leaders across the state, trying to strategize about, try to determine where we are, where we're going, and how we can make things better going forward. He has been incredibly attentive, religious, and thoughtful contributor to those discussions. But what's even more impressive is that though Marty is very good at speaking and making his views clearly known, he really loves to get things done. He is very action oriented, and what he has gotten done within the city of Boston related to COVID is truly breathtaking. He has been almost like an Energizer bunny for the last 3 months, doing everything he possibly can to keep the people of Boston safe and well from this pandemic. We at the MGH have had the privilege of partnering with him and members of his staff on efforts to mitigate the spread of the virus within various communities within Boston, and also testing large numbers of people within the city of Boston. We did a study a few weeks ago in collaboration with the city, testing people in Roslindale, Dorchester, and East Boston with antibody tests, and we just completed a study doing something similar with first responders, police, fire, and EMT workers within the city of Boston. And we certainly hope the results of that testing will be useful to our understanding of this virus, the use of antibody testing, and the health of those individuals. So I just want to thank Mayor Walsh for everything he does for the people of the city, for being such a great friend of mine, for being such a great friend of Mass General Hospital, and most importantly, being such a great mayor for the people of the city of Boston. So Mayor Walsh, the floor is yours. Thank you.
Thank you, Doc. And I want to thank Mass General Hospital for the incredible work that they do in our city in so many different areas. And there's so many stories I could tell you, but two things I just wanted to say here on the phone, on the call, is when we built Boston Hope, that was the hospital that we built over at the Convention Center. We built it in 5 days in Boston, and Mass General and Dr. Slavin and his doctors and nurses, along with Brigham and some other hospitals, but in particular, Dr. Slavin was such a big part of that, and I want to thank him for that. 726 patients went through Boston Hope with COVID, number one. Number two, unfortunately, during these times, we've lost almost 700 people in Boston due to COVID. And some of those folks were at Mass General. And you know, Dr. Slavin's team over there, the compassion and care that they showed all their patients was just simply amazing. And I also know many people who recovered from real serious illness due to COVID. And again, Mass General was there. So I want to thank him. He's a friend, a very nice introduction that he gave me. But I'll tell you, anytime I've called Dr. Slavin, anytime of day or night, he gets right back to me, and he's never said no. And I want to thank you, Doc, for that. I truly mean that from the bottom of my heart. So thank you. To Emily Shea and the team at the Age Strong Commission, thank you. You guys are doing an amazing job. Thank you for that as well. To all of you on the call, if you're sick of hearing my voice, I apologize. You know, we do the robocalls. I think they're really important. These are difficult, challenging times for people. My mother, don't tell my mother I said this, but on March 19th, St. Joseph's Day, my mother turned 77 years old. My mother doesn't drive, but she goes out. And from the first week of March until right now, the only out she does is my cousin will take her in the car, who lives in the house on the second floor, and she'll wear the mask and she'll put the gloves on, and she'll take a ride by my house, take a ride down Castle Island, take a ride to different places. And that's all she's really done as far as socializing. Any nieces or nephews that have come over the house have dropped stuff off on the porch. The only physical contact I've had with my mother, and I'll be honest with you, was on March 19th, her birthday. I went in the house. It was my only time really in the house since COVID started. We had our gloves on and stuff like that. And I gave her a kiss on her forehead to wish her a happy birthday. And you know, as I was walking towards her, I had 2 weeks of telling people not to talk to each other. She put her two hands up. She goes, "Stop!" yelling at me to go near her, but I still did it. I went in for the kiss, and I shouldn't have, but everything was okay. The reason why I say that to you is that these are really difficult times. I know the difficult times for a lot of you on this call. I know the difficult times for your families. I know the difficult time for your friends. But I honestly have to say this, and I think Dr. Slavin could back me up. We have about over 12,000 cases of COVID in Boston. 7,000 plus people have recovered. We've lost nearly 700 people. And I think if we didn't take the precautions that we took early on, those numbers would be a lot different. And I'm asking everyone today to continue your diligence, vigilance, whatever you want to call it, moving forward here. These numbers that I'm reading off at the press conference every couple of days now, they're low, but they're deceiving. They're deceiving because the virus still is here. When Dr. Slavin tells me down the road that we are safe, then I will know that we are safe. But until I hear it from Dr. Slavin or one of the other medical experts to tell me that we're safe, I'm not going to listen to it from the governor, and he's a friend. I'm not going to listen to it from the president. I want to hear from our own health experts here in Boston to tell us that it's safe. It's a tough virus. Many of you, all of you, I don't think anyone on the call, I could be wrong, but most of you didn't experience, or most of us didn't experience the Spanish flu at that time. It was 1917, it came back in 1918. My mother told me a story during this pandemic of my grandfather, who at the age of 15 had the Spanish flu. I had no idea. And his sister lived in Galway. Galway is part of Ireland, and Galway's, it's kind of like, Galway's like, I would say it's probably maybe the size of Greater Boston. And my grandfather's sister came from one side of Galway to the other to care for him. She was 18, and she got the Spanish flu and she died. And you know, so in my house that wasn't spoken about. That's the last time we dealt with a pandemic. A lot of you on this call have dealt with a lot, and you've been through a lot. It made you stronger as people. So I want to thank you for that, for the incredible work and dedication you've done. But I'm asking everyone to please stay safe. We declared a public health emergency in the city of Boston in the beginning of this. We also declared mandatory face coverings. That remains in place. We're asking people to stay home, except for essential reasons, especially anyone over 65 right now. And if you have underlying health conditions, even more so. We're asking people to continue to wash your hands as often as possible with soap and warm water. If somebody comes near your house or whatever, if you go out to get the mail, you should clean your doorknobs off and things like that with some type of disinfectant wipe. Just do it. Just get in the habit of doing it. You might already do it, but again, it's not getting this virus. We're asking people, if you need supports, if anything, call 311, get connected to our 8 Strong Commission. We have served a lot of food and provide a lot of resources to people. Those are the folks that need it. Those of you that own a home, if you're struggling to make ends meet right now, my recommendation, you contact your bank. They're creating programs, and it's going to run out soon, but they're creating programs that you can defer your payments to the end of the loan at no interest and no penalties. We started to reopen the state. The government started to reopen the state a few weeks ago. Phase 2 of reopening plans began on Monday, this past Monday. Included in those plans were retail stores, child care facilities, day camps, outdoor dining, restaurants, and some day spas. Reopening doesn't mean that we go back to normal. It's bringing, we want to make sure people continue to bring caution into the workplaces and community spaces. Boston's a very crowded, densely populated city, so I'm concerned about that personally. We are making progress, and we're going to continue to make decisions based on science and evidence. And as I mentioned, the evidence and science comes from Dr. Slavin. Then I have the actual numbers here in front of me now. I didn't have them earlier. But since this COVID started, the first case of COVID-19 in Boston was in February. We had one young person from Wuhan, China. He was a student here in UMass Boston. The next case of COVID-19 was March 2nd, where we had 2 cases. By March 6th, we had 8. And then after that, you saw the numbers. The numbers just exploded to the roof. Since the beginning, we have 13,074 people who have COVID-19, had or have COVID-19 in Boston. 671 of those people died. 7,893 people recovered. When you think of us in terms of the state, 104,156 people have had COVID-19 in the state. 7,454 people have died. nationwide, I saw the number today, 2 million people in America have COVID-19. 7.5 million worldwide, 2 million in America. One of the things that we've been helping in Boston is our nursing home long-term facilities. They were hit really hard with COVID-19. Many of your friends and people that I know lost their life there with COVID-19. We are helping now. We helped from the very beginning with masks and gloves and trying to get more gowns for them. And we're assisting all the programs in Boston. And we're going to continue to do that until they don't need the help anymore. We are working on testing. We have 20 testing sites in the city of Boston up and running through partnerships with community health centers. Many of you use your community health centers. Our goal is to test 1,600 people a day. We also have mobile testing sites that we're bringing around the city. We have one mobile testing site right now, and we're going to public housing developments and senior buildings. We need to see that positive rate of COVID-19 continue to go down. The test rates for the city, just so when you take a test, the average daily positive test rates for the city of Boston are 21.4%, which means that almost every 1 out of every 4 people that take the test positive. That number is a little deceiving because it's been going down for the last 2 weeks. Yesterday, June 6th, actually last week, our positive rate that day was 5.3%. The reason why the number is so high is in the very beginning, we were having positive cases like 44, 45%. So the average is going down over time, and we're going to continue to work on that. Some of our communities, particularly the Black community first, was testing at a 44% rate. And then as we put in a task force to look at that, we're seeing now that number's coming down as far as positives. Now we're seeing Latino community residents going up. A lot of it is due to intergenerational people living in the house. It might be some people on this call, but if you remember the old days, I can speak for my house. My mother and father lived in the house. Me and my brother lived in the house. And every cousin that came from Ireland lived in the house. So it was intergenerational. We're just kind of always there. There were always 10 people living in the house. And that's a lot of the immigrant community that we have today in Boston. It's the intergenerational. Nearly 1 in 3 of our COVID cases are people ages 60 years or above. So I just wanted to make sure that everyone knows that. I'm not looking to scare anybody because that's not my intention. We're going to continue to work with the governor on the reopening phases and things like that. Just real quick on what's happened with George Floyd's murder. That's sparked a lot of conversation, unrest. I don't want to say controversy in our city. Being the mayor right now, and I'm not looking for sympathy because I love my job, it's really complicated because there's lots of emotions going on in the public. And, you know, I'm grateful that I'm the mayor of Boston. I'm grateful that I'm the mayor right now. And I'm grateful to have so many wonderful people in the city of Boston. When I was a state representative, the 2 constituencies I loved the most were my kids and my seniors. And when I was a state representative, I had 7 senior buildings in my district, and I would go to those senior buildings 3 or 4 times a year, no less than 3, and most times 4 times a year. And I wouldn't go there just on election year. I'd go there every other year as well because those years I was there. A big reason why I'm here as mayor of Boston is because of my seniors. When I became the mayor of Boston, I wanted to make sure that we put the same emphasis. My 2 favorite constituencies still is our kids and our older Bostonians. And the reason why I say that is because of your honesty. And what I mean by that is if I'm doing a good job, you will tell me. And if I'm doing a not so good job, you will remind me. And you're not looking for yourself. If you ask for something, you're looking for someone else. And the same for little ones. So I want to thank you for being on this call. I want to thank you for what you do. I want to thank you for what you mean to the city of Boston. And with that, I think I'm going to turn over to Emily. I think I'm going to take a couple questions. Or
Yes.
somebody, I know who I'm talking. Maybe Susan.
You're talking to me.
Sorry, Susan.
That's okay. My name is Susan Edgman Levitan, and I'm the director of the Stokel Center for Primary Care Innovation at Mass General. And we do have a couple of very important questions and also some gratitude, Mayor Walsh. So you've gotten several kudos for the great job you're doing and for hanging tough. And I also just want to thank you for mentioning Mr. Floyd, because I think it's very important that we take this very seriously now. But the first question we have, there are two parts to it. One is, when you talk about staying safe, can you say a little bit more about how you define safe? And the second part of this question is, how can people safely visit or even hug their loved ones, especially people in assisted living communities?
Great questions. I think both those questions are kind of very, they're tied into each other.
Mhm.
What I mean by staying safe is that I have not really done any public events since COVID started. And obviously a politician, or for me anyway, my natural instinct is to shake hands, and I'm a big hugger. I like hugging people and talking to people and shaking hands. And what I've tried to do over the last 3.5 months is, there's been zero hugging going on. And sometimes somebody will stick their hand out to me and I feel inappropriate for me to say I can't shake your hand. So when I have shaken hands, I've made sure that I've washed my hand immediately, cognizant of touching my face, cognizant of scratching my nose, because that's how you spread COVID-19. And making sure that if I don't have hot water and if I don't have a sink available, I put hand sanitizer on my hands, just until I can wash my hand. And then always wearing a mask when I'm outside. If I'm going for a walk, generally what I'll do is I'm going for a walk and I'm outside, and I've been able to go for walks on the weekends. I'll put the mask below my nose and I'll have it on, but it'll be on my face, but it'll be below my nose. As people are coming, I'll pull it back up, because again, it's about protection. And two things are happening there. Number one, you could be a carrier of COVID-19. You don't even know it. You might not be symptomatic. You could be feeling healthy. Right now on this call, there's a chance that somebody on this call has COVID-19 that will never be symptomatic. But what happens is you're a carrier, and you could actually, if you're coughing or talking, somebody else can get it from you, number one. And number two, if you're walking down the street and you happen to come across a person that's symptomatic, you don't want to catch it from them as well. So I think that's key. I actually, honestly, I'm asking you, hugging has to be out of the question right now, because of, you just don't know. If you're in an assisted living facility, I know it's awful and it's brutal not to be going there. I would suggest you don't go there. I would suggest that you make phone calls. If the staff could help you with FaceTime, and most of the people on this call, at least a good number of the pages, you're on a Zoom right now and you're talking. Some people are on the phone, but if there's any way you could find out how to use FaceTime, it would be amazing, because it opens up a whole new world to you as far as being able to communicate. I've been on a lot of FaceTime calls with my cousin in Ireland, and even though she's 3,500 miles away from me, I feel like we're like next door, and having that opportunity. So I would advise that for you right now. Please take this serious. Too many people have. My brother works in an assisted facility down the Cape, assisted living facility down the Cape, and he's lost some patients down there, and like he was there with them on their final moment, and it was really hard for him, but he was there because on his own time, because when my dad died, we were around him, and I think that it's important for all of us. You got to take care of yourself, because if you're not healthy, then you can't support the people that you support.
Okay, thank you. Another question that has come in, and also more gratitude for hanging tough, is, can you say a little bit about what's happening across the state with the contact tracing?
Yeah, the governor hired 1,000 people to do the contract tracing. I'll explain it in a minute. And we have some nurses as well in public health. We have about 100 people from the state. So what contract tracing is that, let's assume for a minute that I started to get sick tonight and I didn't feel well, and I started to get, I lost my sense of smell, I got dizzy, and I had the symptoms of COVID-19, and I get a test for COVID-19 and I test positive. A nurse or a tracer will call me and ask me questions. And they'll say, in the last 14 days, who were you around? And then I'll have to tell, like, I was around Mary, and I was around Billy, and I was around whoever it was. And then they will follow up with those people that I was around to let them know to prepare for, potentially isolate yourself in the event you have COVID-19. And to do it successfully, meaning that, let's say, assume I got in contact with 10 people over the last 14 days. If those people stayed home and I got better, and those people stayed home for 14 days, then what happens is you're not spreading the virus. And we can literally stop the virus in its tracks. So that's what the contact tracing is, contact tracing. It's not a perfect system yet, but as we open up, we're gonna have to do more and more of it. So when I open construction, we're gonna monitor that very closely. And if a couple of the construction workers test positive for COVID, we're gonna be able to trace back their steps and get those folks, rather than keeping spreading the virus, they actually go home and isolate the virus.
Okay, thank you. I just want to let everyone on the call know there are many questions, but there are two that I want to address specifically to Mayor Walsh. So the first one is, what is the city doing to help prepare if there is another peak, either later in the summer or in the fall, and if that potentially overlaps with our regular flu season?
I think, well, it's probably going to overlap with our flu season. There's no question about it. And I think that, as we get closer to that, hopefully we'll be able to understand that if you have the flu or don't have the flu and learn the symptoms, although they're very similar. And I think staying in touch with your healthcare provider is something that's really important. Your doctor, even if my mother hasn't gone to visit her doctor in 3 months either, but she's staying in contact with the doctor. So just stay in contact with your doctor, because sometimes, so for example, my doctor wants me to call him, text him every morning and every night about my temperature and how I am. So I texted him one day because I woke up in the morning, I felt terrible. I had a stuffy head. I had a little bit of a dry cough, and I'm thinking, oh my God, I have COVID-19. So I texted him and I said to him, I told him the symptoms. He called me right back and he said to me, it's allergies. I want you to go buy some Flonase. I want you to do this, that, and he was right on. So your doctors will know the symptoms. So I think that that's key. I think as we reopen society, it's going to go back to the previous question, the tracing. When we have a second surge in numbers, if we have a second surge, which we probably will, how big are those numbers going to be? Are we at 300, 400 a day? Or are we going to be at 50 a day? And 50 a day, if we get the tracing down, then we can stop the spread of the virus. So it's really going to be complicated. It's going to be tricky. Worst case scenario, we have to shut everything down again. That's worst case scenario. And I'm hoping that we'll have stuff in place, procedures in place, but I'm not sure if that's going to happen.
Okay, thank you. I know you have limited time, so I'm going to read the final question. And that is, we know that racism overlaps with the pandemic and disproportionate contraction due to the health disparities. We've talked a lot about the anti-racism work in the city, but how is the city looking to address anti-racism within city buildings and departments?
We are going to, great question, thank you. I'm going to announce tomorrow, don't tell the press, I'm going to announce tomorrow some short-term programming that we're going to do in the city, and then we're going to be announcing some long-term. So my press conference tomorrow at 10:30, if you get a chance to tune into it, you're going to hear a lot about what we're going to do in the city in dealing with police, health equities, and then in the next coming weeks, we're going to talk about housing, economic development, and schools a little more. So tomorrow we're going to do that. If you don't mind, I'll just take 2 minutes just to quickly run through.
Sure.
There's a question here, what's happening to all the destruction that's happening within our city? Most of those places have recovered. It was mostly, it was damage and merchandise theft. The insurance companies are covering it. That night we were expecting about 5,000 protesters, 25,000 showed up. Of the 25,000, I would say 22,000 were there to protest. They went home. 3,000 people were there. I would not basically describe them as protesters. I would describe them as people who came in the city of Boston to look for trouble. Another question, what do you think about the protesters' lack of social distancing and a surge in coronaviruses? I'm concerned about that. But what we did do, just so everyone knows, we handed out thousands of masks. Every protest that we've had in the city of Boston, we were out there handing out masks to people. So if you saw people with the blue mask on, there's a good chance they got that from us. But I am majorly concerned about the masks. I mean about the spread of COVID because of the protests. We will know in probably the next 4 days. That will be roughly 10 days from the first presentation. I got a private question. I won't say from who. Let me just read here. Hold on, sorry, I read the wrong question. People being disproportionately the ability to have jobs in the private sectors. I am going to be talking to the private sectors on a call tomorrow, and we're going to be addressing the need for more opportunities for people of color in the city of Boston to work in some of the private settings that we have. That's a great question. I want to thank you for that question privately. There's also Ann Walsh gave me a question. I think I already answered that one, Ann, but
Yeah.
we're going to continue to work on some stuff. There's some other questions I can't get to the scroll, but the issue of racism. I'm going to speak for me as a white guy who's Irish Catholic, who grew up in Dorchester. We can't let the murder of George Floyd go by the wayside. It is time for my generation and the ones behind me to finally step up and do something about it. And that means we have to work collectively together to do something about it. Many of you, all of you, most of you, some of you were in the fight for civil rights. And that was a pretty intense time in our country, and voting rights. And that was an intense time in our country, and I thank you for that. And now it's time for us, my generation and the generation after me, to finish the job in a positive way. So you certainly have my commitment as the mayor of the city of Boston, as a white Irish guy, my commitment to listen and to work with everyone in our communities on how we move forward. That's what we have to do. We can't continue to have a divided society. We can't continue to have a divided city. That is not who we are, and we have to do better than that. So I just want to say thank you for the opportunity to speak to you today. I apologize, I got to jump off. I have a line of people outside my door, and they're each itching to come. Not a line, because we're social distancing. There's 4 of them, and 2 of them have masks. So we'll see what happens. But I want to thank you for everything, and if we can help you, please. The H-Strong Commission is here for you. Emily Shea is an amazing director. If you don't know her, get to know her. And all you have to do, if you're a Boston resident, call 311. And I've gone to plenty of events in the city of Boston with the H-Strong Commission that I've been talking to people, and the outsiders sneak in once in a while too. So we'll welcome them back. So thank you, everybody.
Thank you. Thank you so much. We are now going to turn to hearing from Meg Hogan, who is the CEO of the Boston Senior Home Care Organization. So, Meg, are you ready? I think you need to unmute. Over on the bottom, there you go. Great.
Okay, all right. Unmute myself. Let me try that again. Can people hear me?
Yes.
Okay, well, Mayor Walsh is a very hard act to follow, but I'm going to do my best. I'm going to provide an overview of what we do, because a lot of the things that we can do can support you through this time. So I want to talk a little bit about Aging Service Access Points. If you've not heard of that, we call ourselves ASAPs. A big piece of what we do is, it seems simple enough, information and referral. But ASAPs have been around for over 40 years. And in that time, they have looked in neighborhoods, cities, and towns and said, what are the best services? What are the resources out there for older adults and individuals with disability? There's a lot around home care or case management to say, how can we reach out, meet with you together, figure out what you might be eligible for, and then put vetted services into place. Again, I think that's an important piece. So you're not just picking a name off a sheet. You're going to know that over the years that we've audited these individuals or these companies, so that you know that you're bringing in someone that's safe and can do what you need them to do effectively. I do want to take a moment, because we have heard that abuse has risen in these times, to mention that ASAPs also oversee the Older Adult Protective Service Program. And that's really important. If you know someone who you believe is at physical risk, or is being mentally abused, or you're seeing potentially some financial risk where you feel like they're being exploited, this is another avenue that ASAPs can work with you and then follow up on those kind of reports. Again, when you look at this map, what this tells you is that people can dig in deep, because it's not just one agency that's overseeing the whole state. So again, they really understand the services and resources available right down to your zip code. I've given a number here. There's also a lot of links throughout this. And what we're offering to do is to send this PowerPoint. So you're not visually, trying to write everything down and get this. We can send this out afterwards. But Mass Options is a number that you can call, and they can let you know who can help you in terms of the ASAP service areas. If you do live in the city of Boston, Boston Senior Home Care runs Boston Elder Info, and that can send you to services in any of the areas that you can see here in the Boston territory. So we're there to help you, and there's a number here, and there's also a web email address, because you can actually send questions in a form online, so you don't necessarily have to get on the phone. So you heard the mayor. It's not everything you want to hear, right? Because even though we're at a safer at home advisory, we're still saying people 65 and over and people with underlying health conditions, you really shouldn't be going out a lot. You're really still looking at essential services. And that even when you can go out, you're really looking at time-limited aspects, as the mayor talked about. So you might be going to the physician or to church, or I'm hoping at some point soon getting my hair done. Anything that's going to be time-limited, but then you can get back home and safe, and you've worn a mask out there in the meantime. So I think the question is, so what can you do now? What do we do if you're saying you have to be at home and yet you're feeling that you can't get to everything? Well, here's some tips. So this is a link, and this is for the Boston area, but you can find this for other areas. If you wanted groceries delivered, or if you wanted medications delivered, that you could go to this link, and there are numerous, whether it's Stop and Shop through Peapod, whether it's Whole Foods through Amazon, or Market Basket, and so on. These are places where you can call, put in an order, and have that delivered to your home, and you know that you don't have to go out and face that exposure. The other thing that the governor has said is that although the stores are opening, as the mayor said, that stores are still going to be offering curbside pickup options. I know my husband, who has an autoimmune disease, we're still really nervous about this. And this is a great option, because you can pay in advance when you call ahead. You can order it online, and you literally can drive up, open your trunk, and they put the groceries or the order inside your car. So again, you're kind of getting out. I always go for the ride, but also you're staying safe and getting what you need. Doctors are still going to be offering telehealth during this reopening period, as is home care services. So if you can access those kind of services, you can have your signs and symptoms monitored. I think the mayor gave a good description of how that can occur. So again, and these are things that you could call your area ASAP about and ask how you could access these. Of course, they're saying to please continue to work from home. And I'm also thinking of caregivers in this, as well as older adults, so that if you can do that, that's the best thing to do. And then the list that I think a number of you are already aware of around wearing a cloth mask and choosing non-peak hours. Again, I think the non-peak hours is so neighborhood to neighborhood. I mean, I think it's wonderful, for example, that you can go and shop as an older adult, as my husband and I do, at 6 in the morning. We did it initially. What we found is it was a little bit crowded, honestly. There were long lines. So for me, the non-peak hours was really 7 a.m. when others hadn't gotten up yet, but yet missing that peak time. So you're going to want to monitor that yourself and then figure out what's safe. I know people had talked a little bit. I saw some questions coming up about walking outside, and I think the mayor talked about that as well, that yes, you can do that. You want to have a mask, and also it is a nice way, if you can distance, to be able to sit in a couple of chairs and be able to sit out in a short period of time to be able to have those conversations. I wanted to just take a minute to talk about caregivers, and this is actually an older number, so I'm sure it's larger. There are 844,000 caregivers just in Massachusetts. And during this time, there already are issues around social isolation. It now gets increased because you can't necessarily have respite care come in. Friends and families may be quarantined, so you're not getting that avenue. And also, there could be a concern, do you have lack of access to an iPad or technology to be able to have those face-to-face or Zoom calls? So I want to mention the Caregiver Support Program, and Emily Shea's on here, so she can mention that, because this is actually funding that we get through the city of Boston. But Boston Senior Home Care and other ASAPs through the state provide this program to provide extra access to services and resources for caregivers. Once we can get back to respite care, to help with that kind of temporary relief. And also any other kind of complementary care, we're going to work with you. Emily and the city has been wonderful about looking, especially during these times, at making those funds flexible and innovative so that we can be a support even during this time of isolation. I wanted to give a couple of shout outs here, both for caregivers and older adults. If you're not familiar with the Friendship Works program, which has been around about as long as the ASAPs have, they actually will match older adults, not just send someone out, but say, is there a relationship possibility there? Do they have similar things that they're going to be engaged and interested in? Right now, you can continue that as a phone companion service or again through Zoom. And then later on, when we do reopen, we'll actually do face-to-face visits. The other thing is I want to offer the weekly caregiver support group. That's your Boston Senior Home Care. Again, this is free. And you can either call on the Monday 10 to 11, or you can come in through GoToMeeting. But it's just another way to connect with others, talk about what you're going through, and then perhaps access some other supports that are available to you. Finally, again, I just wanted to give a list of resources that could be out there for you. I mentioned some of them. There's a network of care for mental health, the food delivery, but also food resources that are available through City of Boston and so on. And I'm hoping that you might find this helpful in terms of maybe accessing things that you didn't know were available to you. So I just want to thank you for giving me the opportunity to share this with you, and I'm happy to answer any questions I can.
Dr. Nunez Medina, who is a primary care doctor at Senior Health. And when he is done, then we'll open up for questions from Meg for you and for Dr. Nunez Medina. So let's hear from Dr. Medina.
Hi, can you hear me?
Yes.
Good afternoon. Thank you for inviting me to talk today about our reopening plans. First, I will start saying that I am speaking for the MGH Senior Health Practice reopening phase following our current guidelines. If you're not part of this practice, please speak with your primary care doctor's office to keep yourself informed about your practice's current protocols during this reopening phase. As many of our primary care patients know, we have remained physically and virtually open during the pandemic to provide the best care possible. But currently, we're going to continue to provide virtual visits and certainly offer you an in-person visiting clinic if it's necessary. At the same time, we understand that many of you might not be willing to come to visit in person. So for the next few minutes, I will explain how we're keeping you and us safe during this time if you needed to come. So what to expect when you arrive to Senior Health? I think one important thing to know is that you should be the only patient scheduled at the time of your visit. So please arrive at your appointment time. It is very, very important that you do not arrive too early, as we're trying to minimize patient waiting time in our waiting room. In the front desk area, one of our medical assistants will greet you and will help you with the check-in process. Please remember that you can also check in online if you have patient gateway. At this time, the MA will give you hand sanitizer and a new mask if needed. The MA will also check your temperature as well. You will go through some questions about COVID exposure, and if you're accompanied, that person will also be asked these COVID screening questions. After this, because all of this is happening next to our check-in area, the check-in process is complete. The MA will take you now to the vital sign room, and after checking your vital signs, you will be brought to a clean room. There will be a sign on the door saying, it's a green sign next to the door saying this is a sanitized room, meaning that this is okay for use. Once your provider enters the room, he or she will be wearing a mask and gloves and other protective equipment if necessary, as a gown or a face shield. And prior to examining you, your provider and you will remain at least 6 feet apart. If needed, we'll allow one caregiver to accompany the patient in the room, who will also be required to wear a mask. Once the visit is over, after leaving the exam room, it will be marked as needs to be cleaned with a red, it's a red sign, a red banner. The room will be cleaned by the MA following the MGH exam room cleaning checklist. At that time, you will, regardless if you need blood work, lab work, some tests, or you're just able to go home directly, you will not need to stop by the front desk to check out, as your providers will check you out after your visit, and our front desk staff will call you to schedule your next either virtual or in-person appointment. I think it's important to know as well that all surfaces, including chairs and tables, are being routinely cleaned after every use, as well as the things that we're touching, like the computer, the keyboard, the tables, etc. So I think we're all are excited and looking forward to seeing you either virtually again or in person if you need to. And please do not hesitate to contact us if you have any further questions. Thank you.
All right, thank you. I'm now going to go to some questions, and actually I have a question for Meg Hogan. You mentioned the line that people can call if they want to volunteer to talk to people who may be alone during this time. Is it possible, if you are one of those people, if I'm all alone, how do I get connected with a volunteer that can talk to me?
So you would call Friendship Works. That number was made available on the PowerPoint. And what they do is they'll ask questions. It's kind of like the dating game. I know I'm dating myself by saying that, right? But you know, you don't want someone that you can't connect. There's no connectivity there. There's not a shared experience. And so they will work with you to match you up with someone. And as I said, right now, it might be through iPad or it might be through the phone. But if you call that number or reach out for that email, they will help to connect you with somebody.
Okay, thank you.
Question? Yeah.
Yeah, thank you. And just a quick reminder to everyone, we will be sending out a recording of the town hall next week, and that will also include all the slides that you've seen, as well as other resource materials that we know could be very helpful to you. So we've just gotten a question that I think is important, and we've gotten this on some of our other town halls. How are we handling people that may need to have blood work, either before a virtual visit or when they're coming in for their face-to-face visits at Senior Health or some of our other practices? Dr. Nunez Medina, do you want to say something about that?
Sure. So we are right now, our lab is open. So if one of our patients is physically present in the clinic and the patient requires blood work, the patient will remain in the room, and we will contact the MA, one of the medical assistants. Either the blood work will either be done in the patient's room or in the lab area, of course, after the routine cleaning that we're providing. If a patient is not physically present and they require blood work and will need to come to Senior Health, I suggest that patient doesn't just show up, but first call the practice to schedule so not an appointment, but to schedule some lab tests to be done. So the front desk, and the whole staff, is aware that that patient is coming. So again, we do not overlap with other patients that might be waiting to be seen. The other way is, or we can help them. We can tell the front desk as well to call the patient to schedule something, based on the staff's availability. But our lab is open for our patients, mainly if they're coming to be seen in person.
Okay, thank you. I'm actually going to ask the next question. I know that Dr. Russell, who is the medical director for Senior Health, is with us today. And we got a question about what are the precautions that people should take if they've been in Florida and they come back to Boston. I know you answered it on the chat, but I'm a little concerned that not everyone can read the chat. So
that's
you
great.
say something about that. Yeah.
Good. Can you hear me all right?
Yes.
Yeah, so I did do some research. So it's very important if you're doing interstate travel, it's really important to look at each state's website and know what the differences are as they are handling them variably. In Massachusetts, if you are coming in from out of state, you are still expected to self-quarantine for 14 days. Nothing else is required from what I could see on the website, but it would just be important as you're driving into the state to understand that and limit any social activities during that first 14 days.
Okay, thank you. And while we have you, I have another question that came in, and that is, and this is actually a very common question we get as well. If somebody just wants to be tested for COVID, but maybe asymptomatic, can you share a little bit about the guidelines for that currently?
Sure. We're still in a place where we are trying to, we do have the capacity to test people who meet the criteria, and we are able to order that. But as Mayor of Boston said, we're doing contact tracing. Other folks are doing contact tracing in a different way. Some of our patients and family members are asking for testing so that they can go back to work, or if they can visit another state that might require a negative COVID test. So we would be handling that on a case-by-case basis in line with what our incident command recommends, as well as the state and local authorities.
Okay, thank you. And we also have a question about if people need labs but maybe can't get into the hospital easily, is it possible to get any kind of blood test or lab work done at home?
Yes, for many people who are not homebound before COVID, you may not know, but this has been a long-established service that is available for people who are homebound. And many of us meet homebound criteria because we're at higher risk and can't leave our homes. So we do have the capacity to send in lab companies to just go in and check blood work. And so if you and your doctor have a conversation and blood work is required for just routine lab checks, or if there's some other acute issue, we are able to send folks into the home through a company. I would always say, as with anything, as things are opening up in varying levels, it's really important anytime someone comes in your house, you want to make sure that they are practicing all of the things we've been saying ad nauseum about social distancing, wearing masks, and hand hygiene. And if you feel at any point that things aren't safe from that perspective, you should definitely let the person know and also contact that company.
Okay, thank you. Meg, I'm going to go back to you because we have another very important question about the friendship line. So the question is there a current wait list to access a virtual friend? And does the Friendship Works provide their service to people with cognitive disorders?
I think it's going to be on an individual basis. I'm not aware that there's a waiting list, but I can't answer that for sure as of right this minute. You know, if people can call Boston Elder Info, which is us, they can get into more of that detail for folks. And, you know, if they have someone that's really good with folks who have dementia, then yes, I think, again, as you can imagine, it's as people come in and are available.
Okay, thank you.
And this is Emily. I'll just add to that. I know that they do not have a waiting list right now. They actually have had a number of people sign up to be volunteers, which is fantastic during this time. And so they are taking new people. They don't provide respite care. So in terms of providing respite to people with cognitive disorders, that's not the role that they have. We do have a respite program in our office, which right now we're not making new matches, but if someone was interested in that for the future and having respite for a caregiver being set up with a volunteer, they could give us a call at 311 at the city, and we could make that match when we're able to get people together again.
Thank you. And Emily, while you're on screen, I have a question that I think maybe you can answer that came in very early on. And that is, and I think we've all experienced this in different ways. Sometimes when we want to go out and take a walk, we get outside and all of a sudden there are tons of people. And so the question was, much like we've done in grocery stores and other retail places where there are special hours for people who may be at risk, has there been any thought creating areas or times where older people can go out and walk and may not be at as much risk because they're surrounded by a lot of other people?
Yeah, so I don't think that that's something that we've really thought of at this point, but I did see that question. I took a picture of it on my phone and I've texted it over to our Parks Commissioner. I think certainly parks are really important to us here in Boston. We have a park within a 10-minute walk of 98% of our population in Boston, which is fantastic. And it's a great place for folks to get outside. So I love that idea, and certainly will continue to talk to the commissioner about it.
All right, thank you. I think it's a great idea too. So we are almost at the end of our time. So if anyone has one last question they want to send in, now's the time to do it. But while I'm waiting to see if there are any other questions, I just want to let everyone know that you will be getting everything that you've heard about today when we send out the recording. And we have another town hall like this scheduled on June 25th. And at that town hall, we are lucky to have Dr. Don Berwick, who is the founder of the Institute for Healthcare Improvement in Boston. He's also a member of the State Health Policy Commission and is very involved in improving the quality of care for people not only in Boston but around the world. And he's going to talk with us about a new initiative called Age-Friendly Health Systems that is funded by the Hartford Foundation. And it's a program designed to make all of our health care much more accessible and appropriate for people as we all get older. And it's built around understanding what matters to you, in whether it's about your care or your life or your family, friends, whatever, your mobility, your mentation, your cognitive abilities, and medications. So we're going to hear a lot more about that on June 25th. And we encourage you all to join us for that town hall as well. So any other questions or comments before we run out of our time?
Susan,
Yes.
can I mention something? So Emily Shea in the city of Boston and also a number of aging service access points actually do a lot of work around age-friendly communities. So
Great.
if that is a point of interest, absolutely contact us afterwards and see what we're doing.
Great. That's great to know, and that's a great invitation. So with that, I want to thank all of our speakers. You all were terrific, and thank everybody for joining us today. And again, I just want to remind you that if you have any questions about medical issues, please contact your doctor. And although we didn't talk about it today, Senior Health and all of our primary care practices at Mass General are offering virtual visits, either virtually like we're doing now or over the telephone. So if you do have a medical issue or a question, please call your practice so you can schedule one of these visits, whatever is appropriate for you. And I am going to ask one last question in our one last minute. And I'm not sure whether this is for Dr. Nunez Medina or for Dr. Russell, but how long does it take for a positive test result to appear after one has contracted the virus? This is the stump the stars question.
Right. This is a great question, and it sort of is as yet we're honing in on that answer, but we don't have a clear answer yet because, as you know, there are people who are theoretically testing positive, though they're asymptomatic. So it's an in vitro question that we're unfortunately doing in vivo testing right now. So stay tuned on a clearer answer. I don't know, Dr. Nunez, do you have another? Sound right?
Sounds right.
All right, we got that question right on the multiple choice.
Right. And my final request is that you will get a short survey about the town hall today. And we'd love for you to complete that and send it back to us, because that helps us decide what other topics might be important to you or how we can continue to improve these town halls. So we hope everyone has a wonderful afternoon, and thank you so much for joining us today.